So when you're looking at sort of movements from here, so you've got the C7. Alright, if you're not sure which one you're on, I'm only in some ways guessing in some ways, because if you palpate the prominence, you see one sticks out there as loads. So that's probably C7. If I find C6 and you look up, and C6 tends to drift anteriorly, so it tends to disappear. Whereas if it stays where it is, it's probably C7. Yeah? So you almost have to work out where you are. And that's the way you find your landmark. And if you're using the neck as the lever of motion testing, that will take you down to about T3. And if you want to work further down, because he's a bit stiff in here, if you want to work further down, then it's hard to use the neck, because you can strain the neck if you want to, say, palpate down to T7. So what you would do is interlock your fingers behind your neck. Maybe come towards me a little bit. That's it. So sit right on the edge. Interlock your fingers. Sit tall. That's it. Elbows forward. You are arm under their arm. Yeah. So you're cradling. Again, be careful with ladies, obvious reasons there. And then what you can do is palpate here. I'm going to guide him. So I'm going to slump him and straighten him. Okay. So I'm going to slump him and straighten him. So I'm likely palpating spinous process, and then I'll find wherever level. Oh, wait, don't move. And I can feel the lower one, I can feel that one, and I'm just mobilising him that way. Now if I wanted to, I can treat him. If I find there's a bit restricted in extension, I'll encourage extension. From here, you all right? If I find there's a little stiff in rotation, I'll encourage rotation. Yeah? And I can use my heel and my hand, and I can just work through that. That's grand.
Especially for the Irish, that is, isn't it?
Yeah. And if I want to be the other side, it's easier to be able to walk around. Because it's awkward for me to rotate them this way for me. Yeah? So that's a lovely little way. And if you think a muscle energy technique, if you go a little stiff there, just gently pull up, just gently. Once he's activating the posterior extensors, 10 seconds later, relax, take a breath. Then as he breathes out, I can encourage, say, flexion down to that level. Or I can add in flexion, rotation, and side bending if I want to, down to those areas. Okay, so, you know, you okay? Yeah? If you find it's too uncomfortable in the neck, which it can be, put your arms across your chest. Yeah? You just have to cradle him a bit more there. Alright, so you can control him from here, and then I can rotate him around that way. Alright? Away. Huh? Yeah. What we can also do is, just open a little bit, if you don't mind. Again, it might be easier with women and men. Arms over my shoulders. Rest over, rest your head. Just relax.
Now this is what we use.
So, you know, it is physical therapy what you're doing, so get used to the term. So watch now, okay, because I can sort of like, if he's a bit stiff in this area, I do think this is one of the best ways of mobilising the thoracic, rather than doing the thrust we did yesterday, because not everybody responds to that. So from here, my fingertips on the sort of like the gully of a transverse. So you get spinous process and transverse. So from here,